With me today is a very pleasant lady, Mrs. Karam Bulbul. She is a practicing lawyer at the Bangladesh High Court and has been practicing there for many years. Mrs. Umail was plagued by a difficult problem, but it is a very common problem with many people, namely constipation. She had this constipation for plenty of years, at least over 30 to 40 years now. She had visited several places for the same. In that parlance, she was operated for her fistula in 2002. She had a hemorrhoidectomy in 2004. And subsequent to that, her problems were never ameliorated or the problems was never resolved. Subsequent to this, she had a longo procedure done again, which is basically a stapled hemorrhoidectomy in 2020, followed by a stapled transanal rectal resection or a STAR procedure, which was done twice in 2021 at Bangladesh. So almost after 4 or 5 procedures and with a long-standing history of constipation, she was still unrelieved and she kept having the constipation, so much so that she had to use her finger for every movement of defecation. She would not have bowel movements regularly or in a normal, even for a single day. So when she came to me, she was in a very, very difficult state and she was almost pleading to correct her. So it was a very difficult problem for us, and I would like to ask Mrs. Umail to say a few words on this as to what problem you were facing. Why did you come to me?
I am suffering many days ago. That is constipation, and that is collateral problem. I have operated anal fissure 2002 AD. Then I am well about 12 years. I am suffering that problem. I operated longo in 2020, but no relief. Again, problem continue. I again operated in 2020. That is STAR and laser. After then, but I get no relief. That problem continued. So again operated in Bangladesh, I get no relief. So I have come in this hospital and to Mr. Aloy Mukherjee.
I saw Mrs. Umail Karam in my OPD somewhere around the middle of June, and with her difficult problems, we ordered a MRI defecography. MRI defecography showed rectorectal intussusception in its entire length with long segment redundant sigmoid colon. And obviously because of multiple procedures, she had a narrowing of the lower rectum. So with this complex problem, it was very difficult to treat her because of the multiple surgeries she has had and the local narrowing she had. So a rectal manometry and other tests were done in accordance to see how far her rectal continents were there. A gynecological consult was taken to rule out rectocele, cystocele. Although she had small rectoceles, anterior rectocele and cystocele, the main problem was an intussusception in the rectum. So we planned a laparoscopic rectopexy, which was subsequently done on the 21st of June, and she was discharged on the second post-operative day. Subsequent to that, her constipation has remarkably improved and her bowel movements has been very regular, and she's relieved of whatever problem she had. I will ask her to speak a few words on how her life has changed ever since she had the procedure from her previous experience. Mrs. Karam, please.
Yes, doctor, it's very good and very nice. I get most relief. I get relief after his treatment, his proper treatment and operation. I am very fine. I feel very nice and well.
Thank you for the reassuring words. It was very nice, and I'm really happy that we could help you in your treatment, for which you had come a long way. So I'm really happy to be of some help to you, and we hope that you will continue to stay like this, and we'll keep in touch in the future. Thank you, Mrs. Karam. Thanks for this.
I am also thank you, doctor.
Thank you.
You are as my son.
Thank you.
I like you and love you.
Thank you.
And I praised you
Thank you.
100%.
Thank you. Thank you.
100%.
Thank you.
You are a good doctor.
Thank you.
Your treatment is very much better